we're going to divide our pharmacology vocabulary words into two categories. The first category are the ones we're going to go over right now. Those are the ones that will eventually be on your drug cards in one form or another. Then we'll cover a little bit later, we'll cover some of the other vocabulary just so that you can have an overview of what it means. You will need to memorize everything you see coming up right here. And then in the second piece, it's just an awareness level. So let's go over the vocabulary that you have to memorize as part of the course. I mentioned that the drug card assignment calls for you to put down or write down the therapeutic and chemical class of a drug. Therapeutic class is essentially a description of what the drug is actually doing for patients in terms of symptoms or illness or complaint. So common therapeutic classes would be things like antidepressants, analgesics, diuretics. Those are essentially therapeutic classes where we're saying that the medications in this same group are responsible for relieving sort of the same symptom. The chemical class is how the drug works at the low level, at the cellular level, at the chemical level, and it is essentially classified, or you're using it to classify drugs that act in the same way. So in a therapeutic class, you're classifying what the drug does, and in the chemical class, you're categorizing what the drug is. So if we go back to our antidepressant, analgesic sort of example, the chemical class of an antidepressant might be a serotonin reuptake inhibitor, or SRI, SSRI. So the antidepressant tells us that that the purpose of the drug is to decrease symptoms associated with depression. The chemical class tells us how the drug does that. It does that by inhibiting serotonin reuptake. So for every medication, you should have at least one therapeutic class and one chemical class, and many medications have more therapeutic classes than one. There are very few cases where a drug has more than one chemical classification, but many drugs have more than one therapeutic class. A second thing that I want to see on your drug cards is an indication. Indications are the reasons that a drug is given or prescribed. So again, if we go back to our analgesic antidepressant, an indication for Prozac, an indication for Lexapro would be depression. An indication for an analgesic might be mild to moderate pain. So indications represent the complaints that the drug is given in response to. And again, some drugs have only one indication, other drugs have multiple indications. The drug diazepam, or with the brand name Valium, that medication has several indications. It's indicated in status epilepticus, so seizures, tonic-clonic seizures that won't stop. It's indicated in alcohol withdrawal. It's indicated in anxiety and panic. It's indicated in certain types of orthopedic injuries. So those are all indications for the same drug. So like I said, some will have a single indication, others will have several indications. I've also asked for you to record on the drug card at a minimum the generic name and the trade name of the drug, or the brand name of the drug. Trade name and brand name mean the same thing. Generic names of drugs are the ones that it's best to sort of memorize and work in. Generic names are characterized by what the regulatory agencies call a medication or a drug, and it is universal the world over in most cases. So diazepam, which we've used as an example, in multiple countries, diazepam is not known as Valium. Valium is a name that we use here in the United States. In other places like Australia and New Zealand and Europe, they may not use Valium, may not be sold under that brand name, but all of these locations, geographic situations, will use the term diazepam. You can tell the difference quickly between generic and trade names in that generic names do not begin with a capital letter because they're not proper nouns. The brand name, on the other hand, is a trademark of the company that makes the drug, and so those are always capitalized in the course of business. You will definitely want to be able to move seamlessly between these two indication or brand name, trade name. You'll definitely want to be able to look at Valium on a patient medication list and immediately know that that is diazepam. And of course, the significance of that is the last thing in the world you want is to prescribe a medication to a patient that's essentially a duplicate or even triplicate of something they already take, simply because you weren't able to identify that diazepam and Valium weren't the same thing, and so therefore you were sort of recording those as two separate medications for two separate things, when in fact there's actually maybe duplicate therapy there. So being able to move seamlessly between generic and trade names is pretty important. There are test questions both on the certification review and on in this course to know that essentially a trade name or a brand name could be defined as the name given to a drug by the company that manufactured it, and a generic name is given to a drug as by the FDA, by the regulatory agencies. Finally, I asked you to look into three special categories, special warnings, however you want to think about that. Controlled substances, pregnancy category, and any black box warning. Not all drugs have all three of those, and some drugs have none of those three. A controlled substance schedule is something we dive into really deep in week 4, which is well and good, and so I'll kind of just skip past that now. But if your drug on your drug card is a controlled substance, the expectation would be that you will make sure to define which schedule that controlled substance belongs to. Pregnancy categories are often affixed to drugs. Some drugs don't have one at all. Many of them do. And a pregnancy category is a classification. It's an alpha classification, so A, B, C, D, or X. And those letters essentially tell a caregiver or provider or pharmacist how safe or unsafe the drug is to give in pregnancy. It's unethical to perform studies, research studies, on pregnant women in almost all cases. So in other words, we would never want to take a drug. It would never be appropriate to take a drug and say, we don't know if this hurts moms or babies, so let's go ahead and give it and see what happens. Because that is unethical on every level and will never happen, what you'll find is that the classification or the category, pregnancy category of many drugs is essentially just saying we don't think it causes a problem, but we're not absolutely sure. So a quick overview of that is just simply that A is we know that the drug is perfectly safe. X is we know the drug is completely unsafe and it should never be given. And then the three in the middle, basically B, C, and D, just describe our feelings or thoughts or observations about use in pregnancy, but limited data exists. And then finally, a black box warning. Black box warnings, again, not affixed to every drug, but they are affixed to drugs where there is a significantly risky or dangerous side effect. So black box warnings are on certain drugs. For instance, there's certain antidepressants that carry black box warnings because when given to adolescents or children, it seems to increase depression and maybe even suicide, as opposed to reducing it, which is what we would normally expect. So black box warning is essentially the FDA's way of bringing a serious condition to the forefront and saying, hey, before you open this box, before you do anything with this medication, make sure that you understand that this situation is what exists. So those are the elements for the drug cards in a brief definition. Almost all of those we hit in greater detail later, but that's everything that you need to get started with your drug card assignment.